Welcome. Today we are here with Dr. Candrice Heath, who spoke at the Masters of Pediatric Dermatology 2021 annual conference at the Pediatric Skin of Color Symposium on acne. Dr. Heath, what is your personal approach to treating acne in patients with skin of color?
I think treating acne in patients with skin of color does require a little forethought. So yes, the disease of acne is the exact same. However, what can happen because of the acne can sometimes be the thing that is the presenting complaint. So what am I talking about? I am talking about hyperpigmentation. So in treating patients with skin of color, hyperpigmentation is often the lead chief complaint. And it can often, this pigmentation has been known to really impact the quality of life of patients. So if you complete your entire acne visit and you never mention anything about the hyperpigmentation, that visit may not go as well as expected. So with my approach, I always want to address the acne using medications that also can help with pigmentation. For an example, we've known for a long time that topical retinoids not only affect the acne, treat the acne, but also it can also help to begin to treat some of the dark spots. I also include a recommendation for moisturizers with sunscreen. Now, of course, we know that acne treatments can be very drying anyway, but so why not also encourage the use of a moisturizing sunscreen that can help to keep those dark spots from getting darker? And I think the final piece is actually verbalizing that you see the hyperpigmentation in the first place. Because if not, that patient is going to leave the office and exclaim that, wow, I came in for dark marks and they did not even treat me for that. Although we know that, yeah, you did. But if you don't say it, then you can miss the mark on that. And you can lose that patient and they may lose faith in you.
Dr. Heath, can you tell us more about the approved and/or emerging therapies for treatment of acne in pediatric patients specifically?
Sure. So for acne, we have had some medications that have been approved for a long time. As I mentioned, topical antibiotics. We do have some topical antibiotics, new ones in different formulations in vehicles. So for an example, there are foams that have been made available in the antibiotic space. So that's great for being able to apply to the trunk, like the chest and back, for an example, for ease of application. Also, there are new topical medications in the realm of anti-androgens as well. So we know that definitely plays a role in puberty. So I'm excited to see what's to come with that particular medication as well in that new category. And for years, we have had the same oral antibiotics available in different doses, like tetracyclines, for an example, doxycycline and minocycline. But now we do have a new kid on the block, sarecycline, that also is something new to try. In addition, there's topical dapsone, and there are more to come. And of course, oldies but goodies, isotretinoin also. In the right patient population and family may be appropriate for those who have very, very severe acne.
Wonderful. Dr. Heath, can you tell us, how do you educate patients and their families to deal with the more psychological aspects of acne as well as treatment adherence?
Oh, definitely. I think that one of the things that's the most important is actually really setting expectations. So I let people know that this medication may make your skin irritated. And, we all know that people with skin of color, often Black patients, are at increased risk of atopic dermatitis and having sensitive skin. So I often let them know you will be dry and irritated. I incorporate a moisturizer into the plan to try to prevent that. That is key. So setting expectations. When are you actually going to see some results predictably with the acne? That is important. Also verbalizing that, yes, the pigmentation is going to improve over time, but it can certainly take some time. And in the future, there are additional things that we will do. Again, another example of setting expectations. If you take time to look at studies, that talk about quality of life of various conditions, there have been studies that have supported the fact that people with post-inflammatory hyperpigmentation, who are women, definitely have a huge impact on their self-esteem and, in essence, quality of life, dealing with hyperpigmentation. So it's definitely something not to take lightly, because guess what? If you're taking care of a child who has skin of color and the parent is there, this parent probably has a very intimate relationship with hyperpigmentation. And the reason they're there in the first place is because they do not want their child to have to face those same self-esteem battles. So it is way more than just acne. It is way more than just dark spots. So there is a lot that goes into that. And I definitely always like to tell my patients that, I'm proud of them, that I can definitely see that things are working, that they don't have to be perfect. Take the fighting out of it. They don't have to be perfect. Even if they're able to stick to it 2 to 3 days a week, it's going to get better. And I hold their hand through that process and let them know what to expect at every turn.
Thank you so much for your time today, Dr. Heath. It's been a pleasure speaking with you.
Thank you so much for having me.